Going on to our second question. As was eloquently stated by the panelists, we really do have the best health care in the world. But we've heard continued complaints about our health care, especially from the World Health Organization and the United Nations. As Dr. Scioli said, the World Health Organization recently claimed that our health care in the United States ranks 37th in the world because our health care is not sufficiently socialized, because we have a lot of deaths. And we won't go into the details here, but it also includes a lot of cooking of the books. If an infant is born under a certain weight or a certain length, if they die within 72 hours, they're not counted. If one dies after being admitted to a hospital in some countries, they're not counted. If one dies of suicide, they're not counted. And it goes on and on. These same groups, the World Health Organization and the United Nations, they're the same groups who want to take away our guns, our SUVs, and our air conditioners. And I personally don't trust the United Nations or the World Health Organization. I don't agree with their healthcare propaganda reports. And I don't agree with their healthcare propaganda reports that are characterized as medical reports, and I encourage each of you to go read these reports on your own so you can have your own perspective. Going on with our second question, what are the major problems with our current healthcare system? We're going to start with Dr. Scioli on this one.
Well, for me, it's the total lack of transparency in terms of cost, billing, and accountability with respect to healthcare expenditures in this country. I'm telling you, there's nobody out there that can read their hospital bill. You can't do it. Don't even think about it. You don't know if it's accurate. You don't know if it's correct for you. You don't know what the costs were. You don't have a clue. If you buy a pair of pants at Dillard's and a suit and a few things, if there was something amiss on that bill, you can read that. Why can't you read your health care bill? It's hide the salami, people. They don't want you to know because that money can be hidden. It's the shell game when you're in New Orleans, and that guy will beat you every time. He will beat you every time. There is no transparency, and there needs to be. Why can't I publish my fees? Why can't the hospital publish its fees? They can put the Bible and the Britannica Encyclopedia on a CD, and insurance company can't send you the entire list of CPT codes with the fee that will be paid for the service you get. It's called price fixing. I say fix the prices. Fix the problem. Our politicos don't want to go there. You can't expect them or you or me to offer true accountability if you don't even know what the cost is to begin with. Problem number one. Problem number two, frankly, is the access to care. We can improve that. We must improve that. And access to care is not the witching problem of our insurance carriers. They can fix this problem. We can fix this problem. They are not to be vilified. They are the solution to this problem with you knowing what it costs you when you come to see me or go to that hospital. That's what the problem is. You don't know what it costs. Until you do, you can't fix this.
Mrs. Ashmore.
Okay, adding on to what Dr. Scioli has eloquently mentioned, I want to add some additional layers of concerns would include our wonderful friend tort reform. Yes, that's a big The cost of defensive medicine is staggering. The cost of how we do what we do because we're trying to protect ourselves from a lawsuit at the drop of a hat. And it doesn't matter whether it's physician side, insurer side, myself as an agent, broker, facility. It is just crazy out there with levels of expectations and what people think that they can get away with on lawsuits. Immigration is another big issue we need to address. Lifestyle. I want to take 1 minute here to drill down on a comment, and this was a statistic that I saw last year that is pertinent to this conversation right here in Lubbock, Texas. Last year in January, CDC, and this was published in the Lubbock Avalanche Journal, CDC said 50% of our kids in Lubbock ISD are going to be clinically obese. Now, ladies and gentlemen, we have a problem. And it's not a health insurance problem, which is a downline problem. And to some extent, it's not even a health care problem. It's a health problem. And we're not really dealing with the chicken fried steaks. And as a community, we need to be having some very solid discussions on what we can do with our children and our grandchildren, because if we think it's expensive now, just wait till we have 50% of the population clinically obese and diabetic. We won't be able to afford that ticket. So I would challenge everybody for us to really think through what we can do at the community level. We've had layers and layers of mandates and regulations. The insurance piece is so ridiculously complicated right now. It is craziness. I read these things, and we still have to have interpretations on what the words mean. Lack of education is another big part. The system itself is confusing, so there are a lot of downline problems that we can easily fix. Everybody in the insurance industry has already agreed that we can get rid of half of it, but we need to really step back and take a look at the health and the other factors that are truly driving cost.
Dr. Bessler?
Well, in my opinion, the major problems of our current healthcare system are the imposition of a third-party managed care organization between the patient and the physician and the resulting upward spiraling of costs. Managed care organizations serve no indispensable purpose in the equitable delivery of health care, but function simply as costly brokers of health care contracts. It is ridiculously inappropriate for 50 cents or more of each health care premium dollar paid by an employer when it is skimmed by managed care processing costs. This translates to 30% or more for administrative expenses, and those of you who are in business, 17 to 20% or more for net profit or earned surplus. For example, a prominent nationwide managed care organization, the name of which is mentioned in the handout out at your sign-in desk, and please be sure to take a copy of each of the handouts if you haven't already done so. That prominent managed care organization admits to paying its CEO $8 million a year in salary and authorizing him to pick up $1.6 billion in stock options. My God! They talk about providers being overpaid. And this is, well, from its very beginning, managed care third-party payer system was a badly flawed concept. It was proven to be a nightmare of contradictions, patient misery, unwarranted profiteering, and a drag on U.S. businesses. I believe that managed care has been the most corrupting influence on health care delivery at all levels in this country in the past 50 years. To beat the system, you literally have to cheat. And they literally conduct seminars on how to